Hi, I'm Dr. Richard Facko from Palos Pediatric Dentistry, and today I'd like to answer a question that we get asked very often in our office, which is, my child has cavities in their baby teeth. Do they really need to be fixed? And the one-word answer is maybe. The two-word answer is it depends. And to me, I think the right approach from a parent's perspective is to ask questions. So when your child is diagnosed with cavities and you're told that they're on baby teeth, the more questions you ask, the better you can understand the true value and benefit to fixing them, or understand the rationale for not fixing them. So for me, in our practice at Palos Pediatric Dentistry, if you have a child who's capable of tolerating dental treatment in the conventional setting, so they'll just sit in the chair and let you fix their teeth, the answer is usually yes. So if by not treating cavities, we're worried about pain or infection, things like that, to me, the earlier we jump in, the less invasive the treatment has to be. And if we're confident that it's going to be successful in the regular dental setting in the office, those are the patients who you're told that your kid has cavities, you're given the plan, and you walk out of the office and schedule and have them fixed. I think the gray area, the question marks to me are how long is the tooth going to be around? And related to that, how big is the cavity? So an older kiddo, somebody in junior high who's starting to lose a lot of their back teeth, who has a small cavity on a tooth that might not be around for much longer, I'd be asking questions about what's the risk of leaving it alone. And again, in our practice, usually the answer is let's watch and see. And let the tooth fall out naturally without any intervention on our end. Knowing that if the cavity were to get really big really fast for some reason, that our plan at that point would be to just help move it out, rather than investing the time and energy and money into fixing it. So older kids with small cavities on baby teeth, I think a lot of times leave our practice with the information that they have a cavity and hopefully some motivation to prevent future cavities, but with a recommendation to wait and watch and let the tooth exfoliate or fall out on its own. The other gray area to me becomes very young kids or very anxious kids. So now we're talking about a part of the population that can't tolerate treatment just in the typical dental setting. So they're not going to hop up in the chair and be as happy after dental treatment as they were prior. In our practice, one of my biggest priorities is to provide kids with a positive dental experience regardless of what their needs are. So when everybody gets to come in for a happy checkup, it's easy to provide a positive, happy experience. When young kids or really anxious kids have a lot of treatment needs, that's where we usually take a step back and say, let's look at the big picture here and what makes the most sense. So when things like sedation or anesthesia are involved, if we're looking at a kiddo with very small cavities where the 6-month risk of pain or infection is low, you may leave with a plan to wait and watch and monitor. If I were thinking about my own kids and sedation for dental treatment, my priority would be to minimize the frequency or total number of times that they have to be sedated for dental treatment, even if that meant letting a couple cavities get a little bit bigger in the short term, but reducing the frequency of sedation. So to me, the thing that we don't want to do is be overly aggressive treating small cavities in anxious kids on their baby teeth, with the end result that they're being sedated every year or every 18 months. So we can never be completely successful, but my mindset is always to come up with a plan that if we have to go down that road, they're sedated one time for dental treatment. That buys us enough time for them to be older, more mature, and next time, hopefully never, but next time they get a cavity, they had a positive experience the first time around, so they're not anxious and they're able to tolerate a filling just sitting in the dental chair like you or I would. So that's kind of our goal and perspective. Some other thoughts and ideas related to cavities in young kids or anxious kids. When we wait and watch, sometimes there's also some less invasive alternatives that help us buy a little bit of time. So, we have some minimally invasive options, a little bit more on the side of just try to keep things where they're at today so that they don't progress quickly, which buys us time and gives us the ability to wait and watch and evaluate if more cavities are happening. It's nice to fix them all at once rather than risking repeat sedation visits or sedation visits in very young children. So that's how I like to think about fixing cavities in baby teeth. At the end of the day, I'm not a cosmetic dentist. We're really treating quality of life for kids. So we fix baby teeth only because we don't want our kids to have a toothache or an infection. So those are some of the reasons why we might recommend fixing baby teeth. My best advice for you is ask questions. And if you get the impression that your child's dentist fixes every baby tooth with a cavity that comes in the front door, I'd be asking more questions or thinking about a second opinion. If your dentist never treats cavities on baby teeth and says they're baby teeth, they fall out, they don't need to be treated, I'd be asking more questions and maybe seeking that second opinion. So the reality, where we live our life is always kind of in the gray area, and we have to use the right tools for the right patients in the right situations. So I hope you find that helpful. As always, when you have questions about your child's dental care, ask their dentist. And if you happen to be in the Palos Heights area and want to stop by, I look forward to seeing you soon.